Well, good morning, everyone, and welcome. My name's Anne-Marie, and it's my absolute pleasure to welcome you to day 4 of the 2024 Gathering of Kindness. Kindness is my superpower. This week, we've taken a time to take a breath, to reconnect to our purpose and continue a vital and important conversation that's at the heart of our gatherings, kindness. I would like to acknowledge the traditional owners and custodians of the many lands from which we gather today. I join you from the beautiful lands of the Camaragal people of the great Eora Nation, and I extend my deepest respect to their elders, past and present. This land has always been a place of gathering, learning and healing, a place where kindness, compassion and empathy have long been practiced. As we come together today, let us remember that this is and always will be Aboriginal land. A very warm welcome to all of our consumers, carers and community members joining us today. Your lived experiences and insights bring a depth of wisdom that is truly invaluable in shaping a better, more compassionate health system for us all. If this is your first gathering, then we feel very privileged to have you join us, and I hope that it's the start of many more. Thank you for being here and for sharing your powerful stories with us. I often tell anyone who will listen that I am the luckiest girl in New South Wales. Not only do I have the dream job, but I get to work with an amazing team of people. We talk a lot about joy, but to be honest, Kindlab is joy. For me, it's a feeling of gratitude, love and awe. It's hard to believe that it's 12 months since the fabulous launch of Kindlab at last year's Gathering of Kindness. And today we are here to showcase some of that joy. Albeit without Melissa Doyle and Deb Wilcox, who was our Oprah at the time. You're a winner, you're a winner. But we wanted to revisit that incredible launch with a big question: where are they now? We'll be reflecting on how Kindlab has grown and the real impacts it's making in transforming ideas into actions that matter. To get us started, one of the members of the Experienced Dream team, Glenn, will share a recap of Kindlab's original aims and some inspiring insights from our very first year. Then we're excited to showcase and spotlight one of Kindlab's standout projects, the Kindside podcast. And we're really fortunate to have Kylie Wright, the Director of Clinical Governance, Patient Safety and Quality from the Illawarra, Frances Wood, Quality Manager for Out-of-Hospital Care, and Julia Kitcher, the Clinical Nurse Consultant in Stomal Therapy, here with us today. They'll take us through their journey in creating the Kindside podcast and how it's become a meaningful tool to foster connection, compassion, and quality in patient care and experience. And as we dive into today's session, I invite you to reflect on how these kindness-driven projects might inspire and uplift your own work, or if you're here as a consumer or carer, your own experience. And just a kind note, some of the stories shared today may be intense, and we understand this can bring up big feelings and strong emotions. We want you to feel supported, and our team will be posting support links in the chat. Or, if you prefer, come back at another time and listen to the recording when it is made available later today. So now, let's hear from Glenn as he reflects on Kindlab's journey so far. Thank you, Glenn.
Thank you, Anne-Marie, and it's a pleasure to join you from Camaragal land today. I'm really grateful for the opportunity to reshare the vision for Kindlab and reflect on the last 12 months supporting projects centered on kindness. So I want to begin by acknowledging some of the more uncomfortable stories we often hear. Stories where patients and staff are left feeling neglected or treated unkindly in our healthcare system. We know the impact of unkindness and incivility when someone's cold, rude, dismissive, or indifferent. I can think of examples from both sides of the fence. When I was an early clinician starting out in a ward in London, I remember being dressed down in the middle of the ward by a num for what I thought was asking a fairly straightforward question. And I stood there humiliated, and it's an experience that has stayed with me. On the other side, I remember being around 14 years old in a hospital ward and looking at my mum, who was in tears, seething with anger, not at my grandfather's diagnosis of Alzheimer's, but the way a doctor had communicated that in such an uncaring and dispassionate way with my grandmother, who was left in tears herself. So we know the impact of unkindness. We know that it leaves emotional wounds and psychological harm long after our shift has ended or our treatment's finished. And on the flip side, kindness can transform our experience for the better. It shows us that our right to dignity and respect is more than just words on paper, it's real. People are treating us as real people. For sure, small acts of kindness transform patient experience for the better, and with it, their engagement in treatment and their clinical outcomes. And for staff, we start to build more resilient work cultures and more enjoyable work cultures where we're capable of navigating complex challenges that we often face. This week, Gathering of Kindness has been all about recognizing the transformative power of kindness. And now we need to move the conversation beyond individual acts of kindness, as important as they are, but towards a systems approach that asks how our healthcare system can create the conditions for kindness where it can flourish. There'll always be people that seem to be able to be kind, come what may, to pour from an empty cup, but that isn't everyone. As system leaders and managers, we need to think about how can we build and design a system where we can make it easier for people to give and receive kindness. We know our system places high value on reducing waiting times, efficiency, minimizing clinical errors, and we talk about it explicitly every day. But how much emphasis do we place on kindness? How do we talk about it? How frequently do we talk about it? How do we show that we're prioritizing kindness as a system beyond Gathering of Kindness Week? Do we actively nurture it, or do we just expect it to take place? Do we ever stop and think about why unkind or damaging interactions are occurring? So that led us in the experience team, I guess, to reflect and think about how do we, as a team in the Ministry of Health, step into that space to show some form of system leadership that demonstrates New South Wales Health genuinely and meaningfully values kindness and wants to nurture it. Those were the questions that laid the groundwork for Kindlab. So what's Kindlab? For those that weren't on the call last year, Kindlab is a Ministry of Health initiative that we rolled out to build and champion and nurture kindness across the healthcare system. It was launched, as Anne-Marie said, by Mel Doyle at last year's Gathering of Kindness, and we invited people from across the system and community to put forward small-scale ideas that would make New South Wales Health a kinder, more compassionate place. The concept was loosely inspired by Shark Tank in its format, where shortlisted applicants would be invited to pitch to a panel of judges, and that's what happened at Gathering of Kindness last year. Those that were selected would receive funding, along with some coaching and networking opportunities and support from Anne-Marie and some of our team to help bring the ideas to life. And now we're 12 months on, we've got the opportunity to take stock, reflect a little bit, think about how we refine our approach so we can bring back Kindlab as an annual offering to the system and show that we have some system leadership in kindness. So what did we learn? The first thing we learned is really how difficult it is to say no to a good idea, or a kind idea. So in the end, all the people that pitched ideas at the Gathering of Kindness were offered support, and on reflection, what a wonderful and positive way to launch Kindlab. So we've had the pleasure over the last 12 months of really working with 7 Kindlab project leads, and we've seen some fantastic wins along the way, one of which Fran and her team will share with you today. But I'd just like to share 5 reflections from the last 12 months from our end in the experience team. Firstly, we saw and were reminded of just how powerful it is to draw ideas from the ground up. We know that when we listen to staff and consumers with lived experience, people who are closest to the action, we uncover innovative solutions. Things that leadership alone might overlook. Those led to some of the most impactful changes. But that led to the second point. We need to recognize that stepping forward with a new idea often takes courage. There's a vulnerability in sharing new ideas, and putting yourself forward often leads to more work on top of an already full workload. So while seed funding and some support can help, what we really want to focus on next time round is ensuring that there's good local readiness and executive sponsorship that truly supports the project leads. I think, again, this is an example when we talk about the kind side where that was in place and helped the project thrive. Thirdly, it's really important to celebrate small wins along the way. Projects like this don't take shape overnight, and we're often making progress on top of busy schedules and commitments, both at work and at home. So while big milestones like launches or speaking at events like this are exciting, it's just as important to stop and celebrate the small steps along the way, remind ourselves of the progress that we're making. Fourth, and I think this one's important for anyone involved in supporting their workforce and teams, is that when we empower people to lead a kindness-centered project, it becomes so much more than just another task. It brings a real sense of purpose and joy. We saw that firsthand with our project leads. So as an organization, the more we can nurture that sense of purpose, the more we can help people stay connected with their values and more engaged in their work. And finally, I guess, everyone's got room for improvement. From our end, there's certainly room to improve our application process and support processes. If we can simplify things, remove some of the common friction points, what we really hope is that we're able to bring more people forward to share their ideas in the future. And that's what we're working on now for 2025, making support resources clearer for everyone and ensuring that we have a smooth process and a really clearly communicated process for everyone. So we will be back and watch this space. We remain committed to Kindlab. I think we've seen the value of Kindlab over the last 12 months, and you'll get a sense of that with the next presentation. And with that, I'm really excited to introduce one of our first Kindlab participants, Fran Wood, who's a quality manager at Illawarra Shoalhaven. Fran and her team have done incredible work with their project, The Kind Side, and I think it truly embodies the spirit of what Kindlab is all about. So thank you, Fran, for joining us today. I'll hand over to you now and let you introduce your co-presenters. Thank you.
Thank you so much, Glenn, and thank you for sharing your lived experiences. That was really powerful and really touched my heart, and I'm sure the hearts of everyone online. So look, I'm just so happy to be here today to talk about the kind side, and really delighted to be joined by Kylie Wright, Director of Clinical Governance, Patient Safety and Quality here at ISLHD, and also Julia Kitcher, Clinical Nurse Consultant, Stomal Therapy. Now, my beautiful consumer partner, Stacey Lewis, unfortunately has had to share her apologies. She was a co-creator of the Kind Side and would have loved to have been here today. She's very much here with us in spirit and has contributed immensely to the project and today's presentation. And I know Stacey actually reached out and is wishing us all the best. Thank you so much. I can see we've got 100 people online and we're really grateful to you for taking time out of your busy day to join us to celebrate Kindlab and take a look on the kind side of health. Today, we're going to take you on a journey from idea to fruition and where to next. Kylie is going to set the scene by sharing why she backed this crazy idea of ours as executive sponsor, and how, as a leader, she has created a culture where kindness, compassion, and innovative ideas can really thrive. The Kind Side would simply have not been possible without Kylie's support. Next, I'll share how we found our way through the maze of podcast creation and evaluation to produce something really special that we're all really proud of. I'm still amazed when people tell me how much they love the podcast and how the episodes have impacted and inspired them. I just had someone reach out this morning, which is so great. Then we're going to hand over to Julia. She's a clinician and a podcast champion. And she's going to share how she's taking the podcast to new heights by using episodes for team wellness activities and consumer engagement. We often joke that we'll have to rename the podcast The Kind Side, brought to you by Julia, because Julia has personally introduced me to 2 patients and 2 staff to interview. So thank you, Julia. And it just goes to show it really is a team effort. And finally, I will bring it home by hopefully inspiring you to be part of the Kind Side community and continuing to help grow a culture of kindness and compassion in health. Over to you, Kylie.
Thank you, Fran. So in 2023, when Fran came to me with an idea to apply for Ministry of Health Kindlab funding to create a podcast to build empathy and inspire kindness, I didn't hesitate. It was so easy to say yes. I said yes, not only because I thought it was a wonderful idea, but because in my 30 plus years in health, starting as a registered nurse and now working as a director of clinical governance, it has taught me the importance of kindness in health. Something is important if it has great effect or great value, and kindness in health has both. It greatly affects the experiences of our people, including our healthcare workers, patients and carers alike. It affects the outcomes for our patients and the effective and efficient operation of our healthcare systems. And we know kindness is also greatly valued by our people, by our leaders, because it not only helps to create workplaces and create healthcare services where people enjoy being, it's actually essential for the delivery of safe, quality care. So to help us understand why, I'm going to play a short video by Dr. Chris Turner. Dr. Turner is a UK consultant in emergency medicine who co-founded Civility Saves Lives. If you haven't heard of Civility Saves Lives, it's a global movement by clinicians advocating for kindness and politeness between people in health. And it's to combat the risks of incivility and rudeness, which in healthcare can be very serious. So let's listen to Chris.
Healthcare is a complex business. We deliver it across multiple locations, often geographically distant, with lots of staff, and it turns out that how we treat each other really matters, no matter our position in an organisation. When we treat each other with respect, we help people to be the best versions of themselves, and when individuals are the best versions of themselves, we have the best outcomes for both staff and patients. When we talk about how we treat each other, some of this is actually measurable. If, for example, somebody is mild to moderately rude to us, our bandwidth, our cognitive abilities are reduced by on average 61%. And what that means is that we don't perform at the level that we are capable of because our bandwidth has been taken up. And that just seems daft. When we treat each other with respect, we give people the chance to use the whole of their brain and to come up with the best answers. And we pretty much need that all the time. Civility saves lives.
So this slide shows some civility saves lives infographics summarising research into the impact of rudeness and incivility on healthcare workers. You can see the research has shown that rudeness from relatives results in poorer performance from teams under stress. When someone is rude, it results in less effective clinicians who then in turn provide poorer care. 80% lose time worrying about it, 38% reduce the quality of their work, and 48% reduce their time at work. Also, 25% take it out on service users, and that is our beautiful patients and their support people. And rudeness in surgical settings increases absenteeism, decreases attention and helpfulness, and increases errors. It's pretty sobering information. You can see that rudeness in health and the delivery of health care can have serious consequences for our people and our performance. So we'd like to ask for a little bit of audience participation now and ask you all about your experiences and how rudeness has impacted you. If you've experienced rudeness at work, please use the word cloud app to share one word to help us understand the feeling or impact of experiencing that rudeness. There's just not a pretty picture. Disheartening, disempowered, depressed, distracted, worthlessness, incompetence, undervalued, shame. Thanks everybody. So now if I could change your mindset to think about kindness. If you've experienced kindness at work, please use the word cloud app to share one word to help us understand the feeling or impact of that kindness. Happy, proud, creative, motivated. I feel better even just reading those words. Compassion, confident, connected, invigorating, just beautiful. It's clear to see that a kind workplace positively impacts our feelings, performance and experience. And it's this positivity which is why I'm passionate and committed to leading a clinical governance unit where the team role models and exemplifies and champions kindness and compassion as an antidote to incivility. So how can we create a culture at work where kindness can thrive? Our annual New South Wales Government People Matters survey is one way to evaluate culture and inform change. In 2023, results from New South Wales Health are publicly available online and reflect the experiences of over 81,000 people. 51% felt favourable about their wellbeing at work, 59% about their teamwork and collaboration, 66% about diversity and inclusion, and 70% about risk and innovation. And these results, are pleasing, however, have room for improvement. In the clinical governance unit, I have the privilege, here at Illawarra, I have the privilege to lead a team of 40 amazing people. Some of the ways we create a culture where kindness, compassion and innovation ideas thrive are through a shared team identity, a purpose and values, agreed ways of working, and CGU staff who volunteered and were trained as wellness warriors to help nurture our emotional intelligence, connectivity, health, and well-being as a team. This is our team motto and something we truly believe. The strength of the team is each member. The strength of each member is the team. This approach is underpinned by the Illawarra Shoalhaven Local Health District SEED workplace wellbeing model, the Elevating the Human Experience community of practice, and our staff health and wellbeing strategies. In my experience, creating and maintaining psychological safety, purpose and belonging, and creating an environment where people can be the best version of themselves encourages quality and innovation. My team all understand our shared purpose, that we have a pursuit of excellence, an appetite for curious questions and conversations, and a passion for trying new ideas, learning from them, and then trying again. We underpin everything with quality improvement science methodology to enable innovation in a safe, responsible, and ethical way. Shortly, Fran will share how we did this for the Kindside podcast. As the executive sponsor of this initiative, it was a privilege to guide and support this work. I'm extremely proud, and it has been such a pleasure to be on the sideline and watch Fran and Stacey's creativity flourish. For those leaders online, I urge and encourage you to lead with kindness, compassion, and the courage to be creative. Thank you, and now I'll hand over to Fran.
Thank you so much, Kylie. How lucky are we to have an executive leader like Kylie at ISLHD? Wow, I'm feeling motivated and inspired by that. So look, how did we go about creating the Kindside? I kind of want to lift the veil for anyone online who's got an innovative idea, just to share how we went about it. So firstly, to create something as special as the Kindside, we needed some pretty unique ingredients. Firstly, a chance meeting. I met consumer and carer Stacey at the launch of New South Wales Health's All of Us, a guide to engaging with consumers, carers and communities across New South Wales Health. Stacey was there in her capacity as a mental health service peer advisor, and I was there as a quality manager who's really dedicated to partnering with consumers. We got chatting about our shared passion for the power of kindness and compassion, and coincidentally, Anne-Marie was there and she mentioned the Kindlab program. So Stacey and I agreed to get together and see if we could come up with an idea. I mentioned to Stacey that I'd been recording patient stories, and that process involved recording a conversation, transcribing it for the patient to review and approve, and then deleting the recording. So the actual written version of the story was the finished product. And I shared with Stacey how moving those conversations were and how I wish people could just hear the recording and hear the patients and carers and families in their own words and their own voices. Stacey thought that was a great idea, so together we came up with a submission for the Kindlab, and we based it on research about kindness, where it comes from and how to grow it. I took our idea to my direct manager, Gay, and to our wonderful executive director, Kylie, and they agreed to support our submission, which, as Anne-Marie and Glenn shared, was approved for Kindlab funding and support this time last year, which was so exciting. And really thank you so much to Anne-Marie, Glenn, and the team for their support. So then it was time to get started. Now, fortunately at ISLHD, we were able to use our district's existing Partnering with Consumers framework and healthcare experience storytelling program to develop our processes and protocols. The fact that this framework and program already existed was really helpful and enabled us to get started more quickly than we otherwise would have been able to. And of course, we had bucket loads of blind enthusiasm and naivety. We had no idea how to produce a podcast, but it didn't stop us. So we used quality improvement science methodology Our aim was, within 6 months, produce 10 to 12 episodes of a podcast to increase empathy and understanding between people in healthcare settings and inspire more small acts of kindness in health. We used a co-production approach with Stacey as the consumer, myself as the project lead, and Kylie as the executive sponsor. We worked really closely with the Kindlab team. We tested pilot episodes with consumers and staff, and I'm really proud that we met our deadline. We launched in June this year with 15 episodes, and I think we now have 22 episodes and we've got over 1,200 downloads. And again, that's only possible because people like those of you online are share our passion and are listening to episodes and sharing them. So thank you so much. You are a part of this journey. Stacey and I are really proud that we amplify diverse voices through the podcast, from Aboriginal health, the LGBTIQ+ community, and multicultural health. In the podcast, we ask everyday people, what brings you to health? Tell us about an act of kindness that you observed or experienced here. What's one thing you do to be kind to yourself? And what's one thing we can do to show kindness to you when you're here in a healthcare setting? The podcast is called The Kind Side because we choose to look on the bright side of health, to seek out and promote the small acts of kindness that we know make a big difference to people. Thanks to New South Wales Human Experience Week funding, we were able to host podcast listening and reflection sessions with 49 teams across ISLHD earlier in the year, reaching over 200 healthcare workers. And this enabled us to test our theory that listening builds empathy and inspires kindness. So how exactly did we do it? The first step was to ensure we could provide psychological safety for the storyteller, the host, and the listener, and that people understood what a podcast was and could provide informed consent. We also had to think about how we could record conversations in clinical care settings whilst maintaining privacy and infection prevention and control. We also wanted to ensure diversity in the voices that we elevated through the podcast. So we had a couple of tools to do this, and you can see some screenshots of them there. We had a participant information sheet that I provide to people and give them time to read and digest and ask any questions before deciding if they want to participate. We have a participant record form. So this is a document that is confidential and just enables me to have some background information to ensure I can get a mix of gender and age and abilities and culture. I have an interview checklist and guide so that if anyone other than myself wanted to host a conversation, they could follow the same process. And of course, we use the New South Wales Health Media Consent Form, and we manage all confidential documents in a secure container in Content Manager. The second step was actually recording and producing the podcast. Now, this photo here looks nothing like my podcast studio. In fact, I don't have one. So what sets the Kind Side apart from other healthcare podcasts is it's actually recorded in hospitals, in outpatient clinics, in community health centres. So to do this, I use Bluetooth lapel microphones that connect to a receiver on a mobile phone. And I recently recorded some conversations on MS Teams, and that's exciting because it enables us to expand our pool of talent. There's a podcast buzzword for you. So after recording, I edit the audio files using some free software called Audacity. I then provide the final draft of the episode to the person to listen to. I make any changes they require. And of course, they can withdraw their consent at any time. If 6 months, 12 months down the road, they've moved on in their lives and they would no longer want that story out there in the world, that's absolutely okay. We will unpublish it. They can also choose to use their real name or an alternative name if they want to remain anonymous. So once they've approved the episode, I then publish it using Podbean, which is an online production and streaming platform and app. And I'll then share the episode with the Kindside community, colleagues, and our communications team. And Tegan Brodie and friends from the communication team have been a wonderful support for me. And of course, I keep the Kindlab team up to date, and they very kindly promote episodes through their Elevating the Human Experience network. Just another benefit of being part of the Kindlab program. Look, I've never produced a podcast before, but as you can hear, I love talking and I love having deep conversations with people. So it's been a really enjoyable experience for me. So how did we evaluate our podcast? How do we know if it's doing what we hoped it would do? Well, one of the things we did is we actually surveyed listeners. So to do this, I used the New South Wales Health Quality Auditing Reporting System, known as QARS. I created a survey using a Likert scale to assess listeners' level of agreement with statements about how they felt after listening to an episode of The Kindside. I'm so grateful that 150 of my colleagues at ISLHD took the time to complete a survey, and 94% agreed or strongly agreed that after listening, they had a better understanding of the person, they felt inspired to perform more acts of kindness, and that they would commit to performing an act of kindness that same week. How amazing is that? And you can also see on the slide there that we received some wonderful unprompted feedback from staff saying that it was inspiring to hear about personal experiences. They felt grateful. Thank you for doing this amazing. It's lovely to feel appreciated. And I often get people come up to me in the hospital. A nurse might say, oh my goodness, I listened to that episode with the pharmacist and I had no idea what a day was like in their shoes in hospital. That was really incredible to hear that. And that's what it's all about. My theory is that if we can understand each other better, we're going to have more patience, compassion, empathy, and kindness towards each other. And that goes for healthcare workers, patients, carers, family members alike. We also surveyed 25 consumers using a Likert scale and QARS survey. And after listening to an episode, 97.4% strongly agreed or agreed. They had a better understanding of the person. They felt inspired to be kinder, and they would commit to performing an act of kindness in health the next time they were in a healthcare setting. And Stacey and I are really proud that the consumers we surveyed agreed that we discussed information in a way that they could understand and that felt safe for their emotional well-being. Psychological safety for Kindside storytellers and listeners is absolutely essential. Here's a preview of the podcast website. You can listen to episodes on streaming services like Spotify and Apple Podcasts or online. You can see that since we've launched in June, we've achieved 1,200 downloads. So that's the number of times episode files are downloaded to be listened to. And we're averaging about 100 a month, which is wonderful. And again, thank you to everyone online who's listening and sharing. Thank you so much. As you can see, most of our listeners in Australia, but there are a few bots listening in India and overseas. And if you've listened to an episode, I would pop a comment in the chat. I would love to hear what you thought. Thank you so much. Time for me to finish up with just some reflections. So look, Stacey and I had no idea what we were doing, but we gave it a go. And using improvement science methodology gave us a process to do that and a safety net. The process where you test ideas, learn from them and try again, it's just a great way to explore innovation and give it a go. We were able to use existing frameworks and programs within ISLHD and build on that. And as I keep saying, we could only do this with support and people who believed in us and our vision, people like Kylie, like Julia, and so many of my colleagues I know. I saw Dan Shaw's online. He was a great supporter of it. So thank you so much to all our colleagues online. This is your work as well. My heart moment is gratitude for all the people who agreed to record a conversation with me and entrust Stacey and I with their story. Thank you. If any of you are online, I am deeply moved by that. And of course, a highlight for Stacey and I was recording a conversation with Susan Pearce AM, our Secretary of Health. Here's a photo of Stacey and I with Susan. She was such a delight to speak with, and I'm sure you're going to love listening to this conversation. And look, this is one of the many benefits of being part of Kindlab. Anne-Marie, Glenn and the team have connected us with so many incredible people who we can learn from or record a conversation with. And we even got to share the kind side at a senior executive forum with leaders from across New South Wales Health. That was a really special experience, one I'll never forget and one I would otherwise not have had if I had not been a part of Kindlab. And I'm delighted to share that today we are actually launching the Kindside interview with Susan as part of the Gathering of Kindness celebrations. It's going to be available to listen to in full from 11:30 a.m, so straight after this session. But look, for all of you joining online, here is a little sneak peek. So Susan, thank you so much for joining us on the Kindside. What brings you to health?
What brings me to health? Well, I've been in it for my whole working life. Yeah, right from when I left school, and even actually when I was at school, I decided I wanted to be a nurse, and so that's what I did. Yeah, so going back a few years now.
And then at some point you moved into workforce and actually trained law. Yeah. What motivated you to make that transition?
Yeah, look, it's again, nothing about it was deliberate. And I think a lot of people in leadership roles will say the same, you know, particularly women. You sort of tend to follow a path or things open up and, you know, off you go, and sort of little decisions sometimes can really substantially change your path. For me, part of it was leaving Broken Hill in 2001, which was a really hard decision. Just, yes, super hard. And I went to work for the Nurses Association, which is sort of an interesting background for a health secretary. But that's sort of what led me down that path of becoming interested in workforce, in how the workforce feel about the work that they do, how they're treated at work, and the law was something I got interested in, and it took me a long time to sort of, from when I got interested to when I finished it was a long period of time. But you know, I finally did complete it, and it was a pretty good achievement.
Yeah, that's remarkable. Whilst working and raising a family.
Well, by the time I finished it, I was a deputy secretary here, and I'm glad I finished it before the pandemic hit.
And speaking about the pandemic, so as you mentioned, you were in the Deputy Secretary role and also the State Health Emergency Operations Command Centre. During that time, it obviously was an extremely challenging time for healthcare workers and the system. What were your priorities as a leader during that time?
I think keeping people calm, and then also just extending myself with the magnificent team that I was working with, to be managing hotel quarantine, setting up testing clinics, you know, obviously via the districts, in the end rolling out the vaccine, and realising that we were sort of capable really of doing anything and keeping people going, because that was not easy. We were exhausted, we were under a lot of pressure, and I don't think anyone could ever really know what that was like.
And how do you look after each other during those times? Because like you said, during times like that, and even in winter each year when our system is challenged, rightly our thoughts go to our frontline staff, but there are also leaders like yourself working long hours behind the scenes, advocating for more resources, redeploying resources. How do you take care of yourself and each other as a leadership team during those times?
Yeah, I mean, I think that's so important, something that, you know, isn't always valued, or isn't perhaps given enough attention to. I guess as I've gotten older, you know, things become clearer. It's one of the benefits of ageing, in a way. And for me, I think you've got to be very deliberate about cultivating a team that exists in a supportive environment. It doesn't happen on its own. Simple stuff. I mean, even if it's just, to me, a lot of it is quite basic. You know, thanking people, sometimes just completely randomly, like, you know, even just a text message or a call to say thanks very much for what you've done. You know, you're so great or whatever. I think that gives people a real lift. I do write handwritten notes. It is a genuinely thoughtful thing to do for someone. And most of us, I think, I mean, obviously pain conditions are important, but at the end of the day, you know, feeling valued for the work that you do is really deeply important.
All right, just when we were getting engrossed, the snippet is over. Isn't that, oh, you're just going to love that conversation. Susan is so charismatic and open and vulnerable. I just, honestly, I can't wait to share that with you, and I hope you enjoyed that little sneak preview. I'm now going to hand over to my beautiful colleague and absolute champion and all-round kind person, Julia.
Thank you, Fran. And I'm just blown away by the fact that you've had so many episodes in 12 months, considering you didn't even know how to make a podcast a year ago. So I'm just so impressed. I'm so glad to be part of this and to be able to share my story today about how it's important to me from a clinician's perspective in clinical practice. And as a person myself, I really value kindness, and I also lead with kindness as a clinician and a leader. The Kind Side podcast has given me the opportunity to talk about kindness in the workplace with clinicians, other staff, patients and carers. As a qualitative researcher, I've used co-design with people who've had a stoma, and I value the lived experience in informing how we provide care for our community that is relevant, and it also considers what people's preferences are. I'm also a massive podcast listener, and I love listening to other people's experiences and stories. So to be able to encourage other people to share their story is really important to me. And the sunflower on the screen that you can see right now is made by one of the staff during one of the sessions where we listened to a podcast and gave people things to fiddle around with, like Play-Doh and colouring in Human Experience last year. So why am I championing the kind side in the health district where I work? Well, listening to different perspectives from other staff and consumers is really important to us so that we can work together. Clinicians lack time to sit with patients or colleagues due to competing priorities. And, you know, we need to think about why we came into health and what we wanted to do. And it's about looking after each other and other people. But often it's very difficult in a busy environment to be able to find time for that. So the Kind Side has provided a really good opportunity to engage staff in a work-based reflective activity that is not education. Their feedback was that they enjoyed the wellness activity and they want more. And staff aren't able often to go off of the ward to attend wellness activities. So bringing this to them enabled them to access a mindful space. Listening to the Kind Side has broadened the knowledge and understanding of interdisciplinary roles as well. So this is my colleague Sam, who's here today in her cherry scrubs. We coordinate our scrub wearing for our service, and people will absolutely love that. Another just thing to brighten people's days. And so she's recorded an episode of the Kind Side, and as a nurse and a previous patient and a person living with a stoma, she says, this was a wonderful experience, and I'm grateful I had the opportunity to share my thoughts and feelings about who I am, what I do, and kindness to a wider audience. I took part to share my voice and improve understanding of what living with a chronic illness and a stoma is like. Also to share about our specialty of nursing as stoma nurses and raise awareness for the ostoma in the community. So in my experience of asking consumers to participate in the podcast, they are very keen to be involved. And some of these consumers, the stories that you'll hear, they were having a particularly stressful time in their lives. And for some of them, it wasn't the right time, that Fran had to come back to them. But what was interesting was they really were desperately not wanting to miss out on the opportunity once they'd heard about it. And we know that consumers want to be involved in care and decisions about themselves. The podcast provides them to have an opportunity for them to be heard, and for us as clinicians to value the human experience. So we work in a human service where we care for others, and it's important we also care for ourselves and we're kind to each other. On this day here, you can see we're all bunched up in a staff room. It was a very, very busy day. We were lucky enough to get some money to buy some food and some activities for staff, which is important, draw card, of course. But they all squished into this tiny room in the busy of a clinical ward, and clearly they wanted to come. 20 staff attended across 2 sessions on just one day, back to back on the same day, and wellbeing scores that the Fran explained earlier about all improved. They continued to talk about it afterwards and showed gratitude for their activity. As a facilitator, I felt like I was giving them a gift on the day, and this was very fulfilling activity for everybody involved. I would really encourage anyone to use this podcast to strengthen connections in the workplace through understanding others' perspectives, bringing kindness front and centre. I'll hand you back to Fran. Thank you.
Thank you so much, Julia. Don't those pictures of Julia and her team enjoying some connected time together and hearing from Julia just lift your heart? And look, a little personal story about Sam's episode. I've got a dear colleague at work who's an avid listener, and she had just listened to Sam's episode when a good friend of hers shared that she'd just been diagnosed with a condition that may require her to have a stoma, and she was feeling very nervous about it, and she was able to refer her to Sam's episode, and she reached out afterwards and said, "Thank you so much. I feel so much better after listening to that." So that's the dream. Eventually we would love that. It's just a great library of all different stories and experiences that we can all learn from and use as resources as well. So look, where do we go from here? So we were really honoured that the podcast was launched back in June by the Honourable Ryan Park, Minister for Health and Minister for Regional Health. We're really grateful for the opportunity to speak to all of you today. Thank you so much for this platform. And thank you so much. Whilst Susan's episode was playing, I had a look in the chat, and thank you for everyone who put some really lovely feedback in there. Thank you so much for your engagement and support. So look, as a healthcare worker or a consumer, you can continue to cultivate kindness in health by, of course, have a listen to the podcast. If you like it and you think there's value in it, share it, tell people about it. Let's explore opportunities. How can we incorporate episodes into healthcare worker, student and consumer activities as we've been doing at ISLHD? And we actually have a facilitator guide available for this that I'm very happy to share, and I think the Ministry of Health team are going to drop it in the chat there. And in fact, we actually have more teams doing team wellness sessions around an episode this week as part of the Gathering of Kindness. And we're very grateful to have Ministry of Health funding support to do that. You could also think about connecting us with consumers and healthcare workers who might be interested in recording a conversation. And of course, let's all continue to role model kindness in health. Thank you for being kind. This podcast is only possible because there are so many kind people in health, whether you work here or you're receiving services or supporting someone. But look, Stacey and we do have big dreams for the kind side, and thinking blue sky, where could we all go with this together? Well, we actually called the podcast Stories from New South Wales Health because we would love it to be bigger than ISLHD. We would love this to go statewide. Let's just imagine every local health district has someone like me recording stories and experiences from their health district. I'd love to listen to episodes from far western New South Wales or northern New South Wales. Imagine that those episodes are actually incorporated into pre-vocational education, workforce training, recruitment, and consumer education and support. Some of these conversations are absolute gold for learning and quality and safety. Patient Nora tells us how she helps and reassures junior nurses when they're accessing her fistula for renal dialysis. This is so beneficial for people learning to hear. It's a patient saying, it's okay, you don't need to be perfect. Be vulnerable. Tell me that you're new at this. Ask me how I can help you, because I actually know my body and what I need the best of all. It's so powerful to hear that. And staff member Phoebe, she tells us how she actually changed careers to come and work in health, why she loves it, and how kind her workplace is. Let's imagine that as in our culture, we routinely seek out and promote these acts of kindness. Can we incorporate a kind side moment into our huddles, our team meetings, our committee meetings? Can we help patients and visitors look on the kind side by featuring quotes from the podcast on our digital signage and TVs? Can we have quote books with quotes from the kind side in waiting rooms and healthcare worker tea rooms for people to flick through and interact with while they're waiting or de-stressing? Can we have an annual kind side award to recognise peer leaders, consumers and healthcare workers who are cultivating kindness and compassion in health? As you can hear, I'm super passionate about this and I could talk all day. And I'd like to share with you a personal story about where my passion comes from, because I was reflecting, doing this is a lot of work on top of my day job. Why do I do it? And I realized that this is why. So look, this is a really uplifting story, but it does touch on the passing of my baby boy, Ashton. I understand that that is really upsetting. And if this is a space where you need to step away and take a stretch break, please do that. Please be kind to yourself. And I know we've also shared some links to support services in the chat. But here's my story. So when I was 27, my husband and I welcomed our beautiful son, Ashton. There he is. What a gift. He's absolutely beautiful. He lived for 17 days in a neonatal intensive care unit of a New South Wales Health Hospital. He unfortunately had a congenital kidney abnormality. What has stayed with me 15 years later is actually not the grief. It's just gratitude. Gratitude that I had Ashton and I got to be his mum, and gratitude that our healthcare system and everyone working in it cared for Ashton with so much dedication and compassion. I don't remember the expert clinical care he got, and I know he did. What I remember, what stays with me, is the kindnesses. And there were so many, but one that really stood out was this. So one day, my husband and I arrive in the intensive care unit, and a nurse gives us this beautiful hand-drawn name tag you can see there on the slide. And she said that one of her colleagues was working night shift, and she routinely creates these for all the babies in the unit. Wow, that just meant so much. We were so moved. It's a really small thing, but you know what? It meant so much because it told us that the staff and therefore the system cared for Ashton as an individual person with intrinsic value. He's not just another sick baby, not just another medical record number, but he was an individual and he mattered. It made us laugh, it made us smile whenever we saw it in a really intense situation. And it also made the unit feel more like a newborn baby's home. That card meant so much, and I still have it today. Now, I never knew the name of the nurse who drew this. She did not do it for reward, for recognition. It was an act of pure kindness that still inspires me. And I can imagine for the nurse, it was very therapeutic to be able to do this at work in that environment. How can we create more opportunities for things like this that not only benefit our staff and are therapeutic for them, but have such a lasting, deep impact on our consumers. Now, I know we all have a story like this to share about an act of kindness in health that has inspired us. And really, that's what the Kind Side podcast is all about, sharing our stories, growing a culture of kindness and compassion, and supporting and inspiring and learning from each other. So thank you so much for joining us today. And I'll hand back to the Ministry of Health Kindlab team. Thank you.
Wow, that was incredibly powerful, and thank you for sharing that story, Fran. Very moving, and really great insight into what drives you and keeps you going with work like the Kind Side. So we now got around 10 minutes or so for some questions. I've been madly writing down as we've been going through the session today, and there's been a few questions in the chat that I'll try and incorporate as well. But Kylie, I just wanted to start with you. You spoke a little bit about the importance of creating conditions where kindness can thrive. And I was wondering, in your career as a nurse, if there were any specific examples or experiences of kindness that have really shaped your approach to leadership.
Yes, definitely. Thanks, Glenn. I think my approach to leadership was shaped quite early, actually. I became a registered nurse in the early 90s, and that was a time where the university trained nursing was still quite new. And when we started in the clinical setting as new graduates at the hospital, the hospital trained nurses were a little tough on us, less experienced nurses. And I remember this being termed that nurses eat their young. And it was kind of, where the experienced hospital trained nurses were a little tough on us. And I know now, looking back, that was a cultural thing that was going on. But at the time, I remember how some of those situations, very similar to what you described, Glenn, how that made me feel and really affected my confidence. But I was really lucky in that my first year as a registered nurse, one of my first placements was on an oncology ward. And this ward had patients that were dying every day. And I was the only new grad on the ward. And I was only 20 years old. I was just a child, really. And I had no life experience. But the nurses on that ward wrapped so much support around me every single shift. And they showed me really beautiful and nurturing kindness and compassion. And I personally really, as a young nurse, struggled with the death and the dying I was seeing every day. And they knew when I was struggling without me even having to say anything. They just knew. And they would do really small and subtle things, like change the patient allocation so that I would not have to look after a patient in their last hours. Or they'd come and collect me and take me on a break. And I still, all these years later, think about how kind they were to me. So I had this really contrasting experience in my first year in health, which and there are so many other examples of kindness experience I've had. But I guess for me, it is about how it made me feel. And I never wanted to impart the same feeling on other people that I worked alongside. So I've taken that into my leadership approach. It's, for me, kindness is essential. It's my professional and human responsibility as a leader and as a DCG to create a culture where this is prioritised, compassion and kindness is prioritised. And it's the way we do business. It's essential. So projects like the Kind Side are really easy for me to support, because anything that imparts and creates kindness and creates a platform where I can allow staff to be the best version of themselves is my professional responsibility.
Yeah, fantastic. And yeah, what a wonderful experience to have as well from your colleagues, making those changes. Yeah, fantastic. There was just a follow-up question from the chat I want to ask. You mentioned, you referred to the wellness warriors at ISLHD, and there was a comment that it sounded like a great initiative, and people were wondering who delivered the training for the wellness warriors.
Yeah, if I could just, before I answer the question, if I could just tell you a little bit about these amazing wellness warriors in my CGU team. Are volunteers. They're people that I just tapped on the shoulder and said, would you look after the team's well-being for me? And they do this over and above their own jobs, but they do amazing activities and keep us well on a weekly basis, and they're so creative. The training comes with part of the SEED Wellness Wellbeing Program that is in place at Illawarra Shoalhaven Local Health District. And the Wellness Warrior training is a 2-day training where the Wellness Warriors are taken through a series of working with the people that they're looking after to have an individualised approach to their wellness and well-being, not a blanket one-size-fits-all approach to wellness, and then expanding their creativity around that and working with their teams to listen to understand, not listen to fix, and to work with them on individualised programs with what suits them in their setting at the time that they need it. Very, very happy to share more about the SEED with the person who asked that question and share some resources. Yeah.
I love that, Kylie, listening to understand, not to fix. It's sometimes that's the most important thing. Fran, I will turn the questions to you, the usual questioner of the podcast. I get to interview you now. So I just wanted to ask, you've obviously gone through Kindlab. You were one of the winners of Kindlab last year. I wondered if you could just reflect a little bit on the importance of initiatives like Kindlab, or the leadership that you experience in the CGU and support for kindness-driven projects, and just what value that brings, and if it enables you to go forward with ideas like the Kind Side.
Absolutely. Thank you, Glenn, and thanks for turning the tables on me. Look, firstly, I think it's just the opportunity to think creatively and innovatively, because so much day to day we have so many competing priorities and core tasks and responsibilities we need to do, and we all have creative ideas, but it's actually saying, New South Wales Health saying, hey, we actually want you to take a moment, sit down with a blank piece of paper, and what wild, crazy, innovative ideas do you have? And then can you then shape them up as a project that can realistically be implemented in your team or at your site or in your district? And then how could we potentially scale it or grow it to extend the impact? So I think the opportunity and the prompt to think innovatively was wonderful. Then the whole process of making a submission, doing the pitch, was really supportive and not scary. And it was so great to see consumers involved in that and being supported and uplifted to be part of that, not just staff. Of course, the funding is critical in a situation where budget for our services and teams is limited, and things like this don't necessarily take a lot of money. They take passion and time, but just to have that little bit of money. But like you reflected in your session, you need more than the money. You need that culture in your team, in your unit, in your service, that values innovative, creative ideas, values kindness and compassion, and is willing to provide you with support and space to do that work. And honestly, it just would not have been possible if we did not have those conditions in the clinical governance unit and in ISLHD. Then Kindlab also provides you with project management templates and guidance. So I obviously, as a quality manager, have a quality improvement science and project management background, but there's many people participating in Kindlab that don't necessarily have that skill set, and the Kindlab team really supports you in going through that process and provides all the templates and guidance that you could ever need. So if you're online or you're listening later and you've got an idea but you're worried that you don't have the skill set, don't worry, you will be fully supported. I think also the regular check-ins were really important. Sometimes, Glenn, yourself or one of the team would reach out and just say, how are you traveling? And just that opportunity to sort of have that little bit of a debrief and bounce ideas off you, that was really helpful, especially keeping my motivation up under times that were really busy. And then obviously learning from the Kindlab team's experience and everything you bring to the table, and the networking and connections. I would not have had that opportunity to do that incredible conversation with Susan without the Kindlab team. And, we've got some other things in the works, and just networking, the number of times you would reach out and say, hey, I've just learnt about this, let's connect you guys chat. So yeah, there are so many benefits for me as a participant, and I know I'm a staff member, but I'm sure that the consumers that are part of the program are feeling the same way.
Great, thanks so much, Fran. And yeah, it's great to have someone like Anne-Marie in the corner as well. She's a well-connected person and always willing to connect us with people like Susan, etc. So that's great. Julia, I wanted to come back to you. You mentioned in your presentation the kind side being a great vehicle to open up a conversation about kindness, which I thought was, that sometimes is difficult to do in the workplace, to talk about kindness. And you were obviously able to get your colleagues to come and gather, and the kind sides resonated with them. But we know that wards are busy and workloads are very stressful at times. I was wondering, how have you gone about encouraging people to come together and connect, but without feeling that added pressure of needing to come and connect?
So the first thing I do is usually talk to the nurse unit manager, because you need to get support from their leader as well. So I go and speak to them and the clinical nurse educator and introduce the podcast and talk to them about wanting to, do some activities with the staff, and also get some other things like food and Play-Doh and things like that for them to fiddle around with, because it can make people quite awkward just sitting there listening to nothing in a room close together. So I talk to the manager and get buy-in from them, really, to help lead the staff and encourage them to attend. And really, it is just about getting people into a room, trying to find ways of them at the beginning of the day, making time for this later in the day. So how can we help the staff get through their work? What do we need to do as leaders to help free up that time for them? What is happening on that day? If you go on that day and things just aren't looking good, then, respecting that and saying, okay, how about we don't do this today? We'll leave this for another day, because sometimes it's just not the right time. So going in and communicating really well with people, having the courage to have a go, I think, is one of the things as well, and to bring them into the room, because I had no idea how this would go at the beginning. And I was like, oh, you feel a bit silly, you think, oh, how's this going to go? And are they going to they feel really frustrated because they need to write their notes? And are they going to try and do that while they're in the session? So I had to really encourage them to break away. And this was not to do anything else but participate within this room. And there was food. So once we get them all together, just some high energy required really to get that encouragement going on the day, and from not just myself but from others as well. So getting a few team of people together to get people into the room, and then it's really interesting to see how they come in and they listen, and everything just starts to calm. You can feel see their shoulders go down, and you can just see them just really listening and learning while they're there. And then when they leave the room, they just are a different. Their approach is very different to how then they go out into the workplace. You can always see that they are then going to go out and they're going to be kind, and they recognise that they just need to just take a breath. So it's been really interesting to see that it's an extremely busy ward where I'm as well, high acuity, but it's possible.
Yeah, fantastic. And it's so good to see how the podcast can be used in a clinical setting and with workforce, etc. It's as Fran was saying in her blue sky thinking, the opportunities are pretty limitless for this and where it could go. So great to see it being used like that. Look, we only have 15 minutes left, so I'm about to hand over to Anne-Marie. But before I do, I just wanted to ask all the panel really one question. Fran did talk a little bit about heart moments in the work, but just for everyone that's been involved in the kind side, what are maybe the most surprising moments or the moments that brought you the most delight just in this work with the kind side? If you could reflect and just share that with us, that would be great. Thank you.
For me, it's been watching my beautiful team grow and thrive and be so innovative and so dedicated to this work. Beautiful moment for me, and just by complete coincidence, Fran ended up interviewing my brother-in-law who had a terrible bike accident and was in hospital, and the way that came back around was just the universe. Yeah, so lots of happy moments for me.
Yeah, that was an incredible coincidence. Look, for me, gosh, working with Stacey, my consumer partner, was just, I've made a friend for life. And all my colleagues, like when you start something like this, you feel like such a fraud. Like, who am I to have this idea? Who am I to do this? Like, I'm not good enough for this, or skilled enough, or capable enough. What value does my voice have in this conversation? But the support I'm getting from so many people and colleagues, and positivity and reaching out and connecting, it's just so uplifting, and it's what keeps me going. So I'm so grateful for everyone around me.
The moments for me really are when I talk to staff and ask them if they'd be interested. And I've asked a carer the other day if he liked listening to podcasts, and the first thing he said to me, why, do you want me to do one? I was like, yes. And anyway, he said no, but anyway, it was a great conversation with him. Actually, even if he didn't want to do one, I could then put him onto the podcast to listen to while he's travelling up and down the train to visit his wife. But for me, the joy is around when I ask staff and they are so delighted and they go, I do that, I'd love to do that. And seeing them have an opportunity to share who they are and what they do in the workplace with others is amazing. And I absolutely love that. So yeah, thank you, Fran. Yeah.
That's fantastic. Thank you to all three, Kylie, Frances and Julia, for sharing the Kind Side podcast with us today. Just before I hand over to Anne-Marie, I just wanted to, I saw Margaret's had her hand up to ask a question. Just to say, Margaret, we've actually disabled the microphones and cameras today, just to maintain some bandwidth for everyone. So if you did have a question, please feel free to pop it in the chat. We're happy to pass it on to Fran, Kylie and Julia after the session and get back to you. And with that, Anne-Marie, I'll hand over to you just to wrap us up and reflect on Gathering of Kindness this week. Thank you.
Yeah, thank you. Thank you so much, Glenn, Francis, Stacey in absentia, Kylie, Julia, and Kat and Fran, who are part of the Kindlab team within our experience team as well, and of course the broader experience team, for such a beautiful start today. I started off by talking about joy, and I'm actually filled with intense gratitude and awe for each and every one of you. And it's so uplifting to see all of those beautiful comments in the chat. And whilst we didn't have a huge number of people online today, I'd really encourage you, to have a chat to your colleagues. I've been so excited this week to see so many people from eHealth on the call. So Bev, to you and the team at Single Digital Patient Record and also eHealth, thank you for spreading the word around the Gathering of Kindness. It's so wonderful to see so many new people join our family. This week, it's only day 4. We've still got time to go, but it's hard to, so many memorable moments, isn't there? And whilst I say I don't have a favourite child, I do, Laura, but I have actually, I'm sure Daniel will hear about this. I've found myself, laughing out loud and, like today, moved to tears sometimes in a matter of minutes. So I'd love to ask you in the chat, what's moved you if you have had the opportunity to join us for the week, or even today, what's been the standout moment for you? For me, it is really about the profound sense of shared humanity. It's been a tough week. It is always tough in healthcare, but, we had, the nurses' strike yesterday. And amidst the complexity of our healthcare system, we each hold the power to be kindness influencers. We may not always get it right. It may not always be perfect, but we actually can create small ripples that can have a significant impact on someone's day or moment. And as there was some comments about our seed warrior, Padmini, she often talks about small is all. And I think that's what we hold on to. We may not be able to transform the system in one moment or one day, but it is all that continuation, that contagion of actually being that one person who actually does smile or look up at the person who walks past, or provides that pay it forward moment, whether it's to buy a coffee in the line or whatever it might be. A heartfelt thanks to the Nursing and Midwifery Office for their powerful opening on Monday, and Dan and the team who've done such an amazing job to kickstart us off such a wonderful way. And I've been thinking a lot about Fiona and Irene, our 2 consumers, who really reminded us that kindness can be a lifeline in times of pain and uncertainty. Southwestern Sydney and Nat and the team from Transforming Your Experience launched Hello, My Name Is across Southwestern Sydney. And I saw a fabulous photo, one from Jen Coote from Western New South Wales, who was out visiting Lightning Ridge and sprinkling kindness out in Lightning Ridge. On Tuesday, a highlight was our global panel, Nick, Emma and Professor Rich, leading a conversation where Rich actually urged patients and families to ask their treating team, "Tell me about you." And the fabulous Emma G reminding us of the Mark Twain quote, "Kindness is a language that the deaf can hear and the blind can see." And while we had to postpone yesterday's live conversation between Susan and Rebecca Deans, I can assure you it will be worth the wait. 2 absolutely inspiring women and leaders sharing invaluable insights into the power of humanity amongst the rise of technology. And this year we've flipped the question from what's the matter with you to what matters to you. and it's been inspired by pioneers like Maureen Biziano from the Institute of Healthcare Improvement. We were provided multiple stories yesterday and examples of how those 4 simple words can really change a conversation and build trust. Yesterday, we also had the in-person launch of the new Health and the Arts framework. And we're privileged to have Susan and renowned Aboriginal artist Dennis Goldings recount his origin story and his reason for creating remarkable superhero capes. A very big thank you to Amanda Solomon's team at Archery at RPA and Lifehouse for allowing us all to create mini masterpieces, and for the beautiful music. Whilst Kindlab is a personal favourite, every recipient of Kindlab reminds us that kindness can become an everyday practice with transformative results. And I know Kat has put a link in the chat, so you can have a read up about the other Kindlab projects as well. They are extraordinary, and I'm really excited that we can continue to support them until, well, forever, I guess, but also, sorry, Glenn, for also our launch for 2025. I can't let it pass by and just not say how proud and inspired I am by the recognition of some of our most dedicated kindness champions and friends of the Gathering of Kindness in New South Wales Health. As you may be aware, over the last week, each state and territory across Australia have been holding their Australian of the Year awards. The beautiful Sarah De Jong of 1,000 Hearts, who has been joining us on, I think she's on the call today as well, was the nomination for Australian of the Year in Tasmania. The wonderful Glenda Darling, who many of you may know, was nominated for the New South Wales Older Australian of the Year. And last night, and so fittingly, on World Kindness Day, the brilliant Kath Koschel was named the New South Wales Australian of the Year. I've known Kath for, I don't know, maybe 8 years. And Kath was our keynote during the opening of Human Experience Week this year, where she recounted her journey and resilience and her 7 million acts of kindness. And I think for anyone who participated in that day, or it's all available online, you can go and download Kath's amazing standing ovation presentation. It will stay with us for a long time. So I think we're on to something. I think kindness is not soft and fluffy. Kindness is absolutely a superpower. To the Ministry's Strategic Communications team, thank you for your steady guidance and support to promote this week. To our Deputy Secretary, Scott, thank you for your trust. And to the small but mighty experienced team, thank you. You have created a program that has truly inspired and delighted, and I'm so lucky to work and play alongside you. You truly are the dream team. And I hope you agree, they absolutely nailed it. Our partnership with Professor Kath Kroc, or Kath, Lucy and the Hush Foundation has brought warmth and depth to this gathering, and we are so grateful. And to every member across the local health districts, specialty health networks, agencies and pillars who show up every day and daily to provide compassionate and kind care to our patients, families, carers and each other, we see you and we thank you. Today at 12:30, we have another great session called Reciprocal Respect. And in this session, you'll explore how unconscious bias and power imbalances can affect healthcare, often with serious consequences. You'll hear about the importance of diversity across role, age, gender, sexuality, race and class. So please join us for that session. And also, as we look ahead to day 5, the final day of the Gathering of Kindness, we've got a fabulous presentation at 12:30 tomorrow from Louise Scott, who will courageously share her personal journey through an aggressive form of non-Hodgkin's lymphoma alongside her compassionate doctor, Stephen Walker. Throughout this week, I've been thinking about a favourite quote of mine from Margaret Mead. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has. I'd just like now just to spend the next 90 seconds reflecting and highlighting and celebrating some of the incredible achievements in elevating the human experience in 2024. Every achievement, big or small, is a building block for a more compassionate and connected healthcare community. Thanks, Maddie. A gift that keeps on giving. Thank you, and thank you so much, Maddie, for pulling that together. It's wonderful to be able to look back on the last 12 months and just a small snippet of some of the great work that's underway across the system. Please, we'd love it if you could fill in the evaluation. The team are putting the QR code in the chat. But thank you so much for joining us, for your kindness, and for helping create a healthcare community that we can all be really proud of. Please, let's carry this spirit forward as we return to our work, our communities and our lives, and have a wonderful afternoon, everyone. Thank you so much. Bye-bye.